Hello viewers, I am Dr. Rahul Reddy from Androcare Andrology Institute. In this video, we will discuss about micro-TESE procedure. This is a rare surgery and more advanced surgery for people with zero sperm count, where they couldn't find any sperm in the testicular biopsy. This procedure is like a boon for them. In at least 40% of these people where the sperm was not found in regular TESE procedure, we can find sperms in micro-TESE procedure. So what is this procedure? So where it can be done? That means, see, this can't be done in any other hospital. This needs a setup. This needs a very high-end surgical operating microscope with at least 25 to 30x magnification. And a micro-TESE procedure is a teamwork. Only surgeon is not enough. You need surgeon, you need embryology team, because for surgeon it may take 1 to 2 hours for the procedure, because it's a slow procedure. You have to open the testes without damaging the testicular tissue. You have to examine the testicular tissue under microscope. You have to, with layer by layer, you have to slowly search for the tissue, and whenever you see healthy tissue, you have to take that healthy tissue and immediately send it to embryology lab. In embryology lab, again, this takes at least 2 to 4 hours for embryology technician to tease the tissue and look for sperms. So this is a time-taking procedure. So only if this can't be done in very busy IVF centers where there are 10 IVFs per day or 10 cases per day, because it's a time-taking procedure. So that is why generally micro-TESEs we don't do on regular days. We actually see how busy is the embryologist on particular day, then only we'll plan this micro-TESE procedure. So this can be done in only few centers in Hyderabad or in India. So now what happens is, when during the procedure there are two scenarios. One, whether micro-TESE procedure has to be done on the day of IVF, or initially you have to do micro-TESE procedure and then freeze the sperms and start the wife's procedure. This is always a controversy. So what happens if suppose there are very few sperms? Normally what happens, once we get the sperms, we will freeze them at minus 198 degrees centigrade in liquid nitrogen. So sometimes what happens, these frozen sperms, once you try to retrieve them, or we call it as thawing procedure, where you bring them back from the freezing, some sperms may die. So there is chance that all the sperms may die during this procedure. So now my suggestion, or in general what can be done is, because this is the last chance for us to get the sperms, for micro-TESE procedure generally what we do, we prepare the wife on the day of IVF, we do micro-TESE procedure, so that we don't have to waste the testicular tissue. Whatever sperms we get, we can freeze. But in some centers, some IVF centers, there is advanced sperm freezing method or techniques like straw method. So even if there are 3 to 4 sperms, we can freeze them. If we are working with that kind of IVF center, then freezing is not an issue. We can do micro-TESE in the beginning, and we can later, after 3 months, 6 months or 1 year, whenever his wife is ready for IVF, we can thaw them and we can do IVF. So now regarding this micro-TESE, we will try to make videos. We'll show you how the tissue looks, testicular tissue, healthy testicular tissue looks, how to tease this tissue, what instruments are used in this tissue. We will try to make videos regarding this. Keep watching. Thanks for watching this video.